My name is Theodore Pabst, and I'm a vascular surgeon. Peripheral arterial disease has different names. It's peripheral vascular disease, PAD, peripheral atherosclerosis, and it's a buildup, accumulation of fatty deposits in the wall of the arteries of your body. The most common symptom is inability to walk a certain distance without muscle pain. The symptoms are oftentimes, most of the time, exertional in the legs. They're produced with walking. Because I'm more familiar with it than a lot of other physicians, I can often diagnose it based on just a person's history, and that they can't walk as far as they used to. A physical exam is very important. Untreated peripheral vascular disease is a risk marker for cardiac disease, for what we call coronary artery disease, and that's similar blockages involving the arteries of the heart. These things can progress, and not only in the legs can lead to potential for amputation if it's severe enough. That's not very common, but it can happen. But also, since it's a risk factor for atherosclerosis elsewhere in the body, it can place somebody at risk for stroke, heart attack, or even worse. As far as the treatment of PAD goes, we tend to divide it into conservative measures, basically control different risk factors: hypertension, diabetes, hyperlipidemia, and then we encourage exercise, weight loss, as well as what we call antiplatelet therapy and the statins, or cholesterol lowering drugs. Most of the time, the treatment of this is directed to enabling somebody to walk further. And exercise really has been shown to be one of the most effective ways of improving walking distance. For people that are very active or develop an ulcer or present with what we call critical limb ischemia or tissue loss, then that's a different situation. Then it's more mandatory to approach these patients with more aggressive treatments to open up the blockages, open up the blood vessels, to improve the circulation. Without doing that, they're at risk of worsening tissue loss, or even loss of part of their foot, or even a major amputation. The options then are divided basically between what we call endovascular treatment versus surgical bypass treatments. The endovascular is, for most people, an initial starting point. Minimally invasive treatments that we offer at Champlain Valley Vascular are in an office setting. They're all under local anesthesia with what we call conscious sedation, but people don't need to go to sleep. They don't stay overnight. We have the ability to do what we call angioplasties, which is placing a balloon in the blockage and enlarging the blockage, enlarging the opening in the blockage with a balloon inflation. Oftentimes we need to place what we call stents after ballooning to help hold the blood vessel open and maintain a larger lumen. And we also have other devices, something called atherectomy, which at least in our particular situation, we use laser, what we call laser atherectomy, which works with amplified light to alter the blockage and make it easier to treat with balloons or stents, and that's been very successful. Both endovascular and surgical procedures appear to be equally as effective in avoiding amputations. Angiography suites like we have here are quite common around the country, and more patients are treated there. It's been demonstrated a number of studies that the safety profile of having something done in an office-based setting and going home the same day is just as safe, if not better, than hospital-based systems. The care is more personalized. When patients come in the morning, they know who they're going to meet. They've already met us, and we're the same ones that will be here to render their care. We'll be the same ones to take care of the patient after the procedure. Here at Champlain Valley Vascular, we're fully accredited by the state of New York, which is a requirement, and so we have to maintain ongoing excellence with reviews, and there's a lot more than just doing procedures. It's maintaining quality care.